Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about Nashville's new senior ride program, the truth about common medical myths, and what you need to know about radon. That's all coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi, everyone. You know that driving helps us all stay independent and able to get around, but as you get older, it really is an important tool to make you feel independent, and that's what we're talking about today with our first guests, Carrie Brumfield and Ed Cole, talking about Nashville's new senior ride program in Davidson County. Thank you so much for coming in to talk about this.
Thank you for having us today.
We know that it's a big deal to take keys away from folks as they age. Sometimes it's necessary because the chance of accidents, of being injured, definitely goes up as people age. So Carrie, tell us about this program and the goal of the program.
Great. Senior Ride Nashville is a new nonprofit organization here in the Davidson County area. We strive to improve the quality of lives of older adults in our neighborhoods by providing volunteer-powered transportation to enable our members to stay connected to the community and maintain their dignity and their independence. And we do this by recruiting, screening, and training volunteer drivers who use their own vehicles to provide safe, affordable, and assisted transportation to destinations like medical appointments, grocery stores, or anywhere they'd like to go in the Davidson County area. And our target population are Davidson County residents aged 60 or older that no longer drive or limit their driving. And they'll also be able to transfer in and out of a vehicle with limited assistance.
How did this come about, Ed? I'm sure that this, I don't know if this is a pilot program, if this is going on in other parts of the country. I can only imagine it may well be. Did you get the idea from somewhere else, or how did it come about?
We did. Senior Ride Nashville is an incredible convergence of several things. First of all, as Carrie just mentioned, and as we know, the number of older people is growing tremendously. In just 2 years, by 2020, we probably will have nearly 1/4 of the population in Davidson County over the age of 65. And that's a pretty significant number.
It sure is.
And the older group, even the 85 plus, is one of the highest growing age brackets in our population. Secondly, the Council on Aging of Middle Tennessee, whose main role is to look for needs for older adults, had identified transportation and mobility as one of the key things that we need to address. So in that spirit, we brought together a senior transportation leadership coalition of people, volunteers, professionals, for-profit, nonprofit, government, to come up with a plan for how to address the need. And the third piece, the governor's office in 2014 issued a task force report on how to do senior transportation, and they highly recommended the volunteer transportation model. So we didn't have to spend a whole lot of time going around the country. We had that report in our hands. So the coalition, with that report and the support from the Council on Aging, gave countless hours of work to refine this, and Senior Ride Nashville is the result.
It seems like a real common sense solution to an issue. In other words, instead of like a mass transportation thing, which is so, extensive and can be so costly, obviously, what we're dealing with in our community, but for the one-on-one kind of getting people around, it sounds like a fabulous solution to an issue in every community. So what are the requirements to get a ride and to take care of the costs?
Well, a new future...
And is there a cost? That's what I meant to ask you.
Sure. A future rider or somebody that's interested in our service, or if their caretaker is looking for rides for a loved one, they can call our office at 615-610-4040 or visit our website at seniorridenashville.org, where they can obtain an application and a few forms to fill out. Once those forms have been completed and returned to us, we do schedule a very brief in-home assessment with each of our riders with an occupational therapist that will ensure that that rider will be safe in transferring in and out of a vehicle. And after that, they would pay a $25 membership fee to activate their plan, and then they would pay just $6 per round trip ride.
Okay, are there restrictions on where they go? Like they can't just go, like they want to go to the mall, or does it have to be something that's necessary, a doctor's appointment or going to get food or prescriptions? Are there any restrictions?
We do not restrict destinations. We see this as an opportunity for these older adults to maintain their dignity and their quality of life, and that we just want to allow them the opportunity to go where they need to go. We do ask that those trips remain within the Davidson County boundary, and that each round trip ride would be about 3 hours or less. However, if for some reason there's a longer appointment, we can split the trip and give 2 different volunteer drivers on each end of the visit.
Okay, so volunteers are a critical component, obviously. What does it take to be a volunteer, Ed?
It takes to be a volunteer with Senior Ride Nashville a willing spirit, a car, a good driving record. All one has to do is go to our website, seniorridenashville.org, or our phone number is 615-610-4040. And there's a little button there, or the person you talk to can guide you there, says give a ride. And sign up to be a volunteer. We then go through a screening process, background check, to make sure that the driving record and the criminal records are clean, which is important. And then we have a training program, and the staff will guide you right into the training. It's a very brief training process. And from then on, you look at, you can go online or do it on the phone and look at people that are looking for rides and say, I can do it then. And you then click and you match it up, and the instructions about where the person is and the background are given to you, and you do the trip.
Has it been working so far? What kind of feedback are you getting?
It's been incredible so far. The riders are absolutely delighted, of course, with the experience of having that ride. I think the volunteers, this is more than just giving a trip, it's creating a relationship. And each volunteer talks about the stories of the person, the friend that they have made on that trip. And then they kind of work together to maybe see if they can do a follow-up trip with that person. So it's incredible.
That is wonderful, because for a lot of seniors who are alone, there is that feeling of isolation as well as loss of independence if they can't drive anymore. So you are offering several things in this experience. Okay, so to get more information, would you give us the phone number and the website again? I know we've had the website up, but let us know again.
Absolutely. Anybody can call our office, whether you're interested in becoming a rider or a volunteer driver. We need you both. And we can be reached at 615-610-4040.
Terrific.
Or by visiting our website, seniorridenashville.org.
I love it. I think it just sounds just a beautiful program. Thank you,
Thank
Carrie
you.
and
Thank
Ed.
you.
Thanks so much.
Thank you.
Take care. We'll be right back after this. Did you realize that before you wait in an emergency room for hours and hours and end up with a potentially huge, sizable bill, there may be another option for you if you find yourself in a situation where you need some emergency care? Well, there are options, and one we're going to talk with our guest about today is called Physicians Urgent Care, and Dr. Ty Babcock is one of the 7 physicians that started this.
That's right.
Nice to have you here.
Thank you. It's nice to be here. I appreciate it. Always enjoy the opportunity to come on and talk about Physicians Urgent Care.
Okay, this is something that came about. You saw that there was a need for this, obviously. I know from doing stories for many years about people that really use the ER as their primary source of care oftentimes if they don't have a regular doctor. And so you get that backup, people waiting and waiting. So you're filling a niche here, aren't you, for people where it's not life-threatening, but it is an emergency for them. So tell us, what kind of injuries are you treating?
Sure, absolutely. And so what we've found is that oftentimes a lot of people maybe even have primary care doctors, and their primary care doctor is so full that they can't get an appointment. Maybe they were in a minor car accident, they fell, they sprained their ankle, maybe even broke it, maybe they're sick and they're vomiting, or things that may be outside the scope of what they would typically see their primary care doctor for that aren't immediately life-threatening and can be taken care of in a faster, cheaper setting. And so that's kind of what we saw, and that's what we wanted to bring to the community.
All right, and how many locations are you in right now?
So we're in 4 locations in Middle Tennessee. Our first location was in Franklin, then we opened one in Brentwood, and then this year we've opened up Berry Farms, and then even 3 weeks ago we opened up one in West Nashville at Nashville West Shopping Center.
So what really makes this different? We know there are lots of urgent care
Sure.
clinics around our area everywhere.
Right.
So how is this different?
Well, we're locally owned. We're all physician owned, so there's 7 of us that own it. We're not affiliated with any hospital system or any large corporation, and so we really opened it to try to give the best patient experience that we possibly could, and that was the end goal that was in mind, because we're taking care of our friends and our neighbors, and we wanted to provide the experience that we would want ourselves or our family to have. And about 95% of our patients actually would highly recommend us to their friends and neighbors, which is really the best compliment that we could get.
So you're getting good feedback, obviously, to
We
share
are.
that with us.
Sure.
Do you still see people overutilizing the big emergency rooms? They are, aren't they?
They do. You know, I think people, they make the best decisions they have with the
At the
information that
time.
they have. Exactly. And a lot of people still don't know that there are other options out there. Maybe they called their primary care doctor and either they were not able to be seen that day or the next day, or maybe they were told to go to the emergency room because it was outside of the scope of what they were able to do. And so the patients are just doing what they think is best. And so we're really trying to get the word out there that there are other options out there.
So help educate us, help us to understand how to get the right care at the right place.
Okay, all right. So there really is a spectrum there of different clinics. And so I think on the sort of this end of the spectrum, you have a retail clinic or maybe a walk-in clinic that's you would find maybe at your pharmacist or in a busy retail area that are a little limited in the scope of what they can do. They have a very tight set of protocols. They're usually staffed by either a nurse practitioner or a PA, and they're able to take care of maybe a sore throat, a cough, low-grade fever. Some of them are able to do urinary tract infections and those sorts of things, but they don't have x-ray available. They don't really do a lot of suturing, that sort of thing. They're usually your cheapest option. They're usually pretty fast, and they're available. They're everywhere. In the middle is more of an urgent care type setting, which is what we do. That they're a little more broad in a scope. You know, they're even then there's not some standard that an urgent care can do X, Y, and Z. There are some that can do more, some that can do less. So it's always important to sort of call before you go to an urgent care center to make sure that they're able to handle whatever it is that you're coming in with. But usually there's an X-ray available. They do laceration repair. They can do abscess repair, maybe minor orthopedic things, and then they may have medicines that they can give their own side as well.
Okay, so this is something I find really interesting. They call you the medical myth buster.
Yeah, whoever they is.
Whoever they
Yeah.
is that the case, and why is that?
Sure. You know, I think you see a lot of the things that sort of get perpetuated in popular culture that just sort of make you scratch your head sometimes, and some are a little more obvious, and some are not. And so yeah, it's just fun sometimes to like, sort of poke holes in things, I guess.
What are some of the most common ones, the medical myths that you hear?
Sure.
I think we've got a list. Like one was on the flu shot.
And I think that's an important one because I think that potentially opens people up to harm. I think flu shot is one of the most important things that you can do every year for your health. A lot of people don't realize that flu actually kills people. A lot of people die from the flu. And you know, we always talk about, oh, I've got a bad cold, well, I must have the flu. Well, no, the bad cold and flu are two very different things. And so getting a flu shot every year can actually protect you, even on a year like this year where maybe it doesn't match up very well with the flu. It still can make the disease a lot less severe. And so it is true that you can sort of feel bad after getting a flu shot. You may have a low-grade fever and a little body aches and that sort of thing. But because the shot is made with either a dead virus or an inactivated virus, there's no way you can actually get the flu disease from it.
Okay, there's another myth that you should drink 8 glasses of water a day. That's a myth?
Well, it's more just an overgeneralization, I think. Certainly you don't want to be dehydrated, but you and I are two very different sized people, and so the amount of water that it's going to require for me versus the amount of water you would require is two completely different amounts of water, and then your activity level also plays into that. And so it is important to drink plenty of water, but again, the 8 ounces, I wouldn't beat yourself up about.
Okay, all right. One more quick myth. Cold weather makes you sick, and we are in the midst of cold weather now.
I hope my mom is not watching right now, I'll be honest with you, because that was the one that she always told me. There is no evidence that the temperature makes you more likely to get sick or not sick. Some people will cough more after being out in the cold, but that's more from reactive airway, almost more like an asthma type effect than any illness.
All right, thank you for clearing some of those myths up, the myth buster. Dr. Ty Babcock with Physicians Urgent Care, thanks so much for taking the time to come in.
I appreciate it.
All right, take care, and we'll be right back in a moment. Here's an important number for you. Nearly one out of every 15 homes in the U.S. is estimated to have high or elevated radon levels. And my next guest, Lori Munkaba with the Tennessee Department of Environment and Conservation, knows a lot about this and can educate us more in this upcoming segment about radon and how to protect ourselves and how to get our homes tested so we know if it's an issue. What is radon, Lori? What really is it?
Radon is a naturally occurring gas that is caused by the decay of uranium and thorium, which we have all over the world. So it is a naturally occurring decay process, and what it does is it becomes a radon gas, and it enters, it comes up through rock formations, and then it will enter your home through cracks in the foundation, through windows that may be less than energy efficient, or doors or roofs, and sometimes in your water systems.
And it's not something that you can smell?
No, you cannot smell it, see it, taste it, and that's the unfortunate part about radon. And the only real way that you know if you've got any radon issues in your home is to test your home, and that's what we encourage everyone in the state to do.
Okay, now it's not something that is just done automatically. Like when you purchase a home, do you have to have it tested? I feel like most of the time when I've purchased homes, they've either made me do a radon test, or they encourage you to do that. It's not a requirement necessarily.
No, it is not a requirement. There are a lot more people that are testing their home for radon, and it is something that when you do test your home and go to sell it, you will tell the realtor, the real estate agent, that you did test your home.
Got it.
But it is not something that is required.
It's not
So it's
required.
kind of, that's where we want to make sure that people are doing that and testing their home frequently.
Thus raising the awareness while
Correct.
you're here. And I know you did bring in it's just a very small
did.
kit.
I did.
If you want to hold it up, yeah.
It is a very small test kit. We do offer these for free to citizens of the state of Tennessee. We have that number that you read, they can call, and we do have these available. We send it to you free of charge. You turn it back in. There are test kit instructions in there. We also have a YouTube video that will walk people through how to test their home. You send the test results back in. You will get a copy of your test results, and then the state of Tennessee, our office, also gets a copy of those test results. And if it comes back with a high level, which is 4 picocuries or above, and it will state that very clearly in your test results, we encourage everyone to retest their home. Don't be upset about it. Retest your home. If it comes back high a second time, then we have certified mitigators across the state of Tennessee that can help you address the issue.
You've said, prevention is a whole lot easier than taking care of it after you've got a problem, if you can prevent it in the first place. So how do you, besides testing for it, is there a way just to make your house, do you want to just make sure every crack is filled and windows are tight? What can you do?
I think there are a lot of construction companies now that are mitigating homes for radon just as a part of their construction practice. There are certain counties across the state that is in their building code. More people are doing it and are aware of what it is they need to do. So yes, making sure that your home doesn't have any cracks or cracks in the foundation. But I think it goes back to just making sure that your home is tested. That is the first step. In knowing what it is you need to do.
Okay, so the real issue here is it can really be harmful to your health. That's why we need to know about this. So can it lead to cancer?
Yes, radon is unfortunately the second cause of lung cancer in the country, behind smoking. So it is a real issue, and it's not something you can see, taste, or smell. And unfortunately, by the time that someone may know that there's an issue, it may be too late because they just did not think about testing their home. So we cannot encourage people enough to make sure that their home gets tested for radon.
Okay, so where do you see more cases of high radon in Tennessee than others? Is there a certain geographical part of our state that is more at risk due to their particular soil and the components, in their soil and the rock?
I would say geologically, probably East Tennessee down to the Chattanooga region probably has the most high consistent levels of radon. Middle Tennessee falls somewhere in between. Less issues in West Tennessee because it's a lot of soil and not as much rock that has the uranium or the thorium in it. However, that's not to say we don't find really low levels in Upper East Tennessee and high pockets in West Tennessee. So Tennessee is one of those unique states because our geography is so different, and I guess it gets back to the thing of just making sure that you test your home.
Okay, so again, these packets are available. They're free, and then they would send them back to you. And so there's no cost involved there at all?
No, there is no cost to the citizens. We've been doing it about 7 or 8 years at no cost to the citizens. You call in or you can email us. You give us your information. We send you the test kit. Again, you follow the instructions there or the YouTube video, which is very informational.
Okay.
And then you hang it between, I think, 3 to 7 days in your home in a certain place. So you need to be careful that you read the instructions. If there's anything you don't understand, please call our office and we can walk you through it. You send the test results back to the company that we get the test kits from, and they will send you your results back.
Might there be symptoms that a person would have that would lead them to think they may have a radon problem? I mean, I guess it would be so generic in a way, right? I mean, if you're coughing a lot, that could be so many different things.
I think if people are aware, I think where we've had issues again is people that do have those lung sort of issues and are not smokers and don't think about radon as being a possible cause. Good thing is a lot more physicians are aware of it, so that's one of the things that they are starting to look for initially as well, especially if you've never been a smoker.
Okay, great information. Thank you so much,
You're
Lori.
welcome.
Thank you for watching Community Health Matters. Learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.